Myself Dharshini, MSc Nutrition and Dietetics lecturer in E.S College of Nursing. Today we are going to discuss about therapeutic diet. In this it is a specially modified meal plan tailored to meet the nutritional needs of individuals suffering from specific health conditions or diseases. It is designed and prescribed by healthcare professionals, often involving adjustment to the type, frequency, amount, or consistency of food to aid in medical treatment and recovery. And it also concerned with planning of diets and maintaining health and in prevention and treatment of diseases. It is a science as it uses the rudimentary principles of nutrition, and it is an art as it concerned with the aesthetics of food service. It is plant diet used to supplement the medical or surgical treatment. And therapeutic diet is mostly concerned with qualitative and quantitatively modified version of a normal regular diet, which has been tailored to suit the changing nutritional needs of a patient or an individual and is used to improve a specific health or disease condition. So the objectives are it maintains a good nutritional status and correct the nutritional deficiency which may have occurred due to the diseases, and to plan to provide a diet that is most suited to the disease condition, to adjust the food intake to the body's ability to metabolize the nutrients in sickness and decrease the body weight whenever it is a risk factor, for example like obesity or in a heart health condition. And the principles are it must be planned in relation to changes in metabolism occurring as a result of disease. It must plan according to the food habits of the patients based on the culture, religion, socioeconomic status, personal preferences like dislikes or likes, physiological and psychological conditions, hunger, appetite, and satiety. Changes in diet should be brought gradually, and adequate explanation are given with the changes made, if any. And the principles like in short or acute illness, the food should not be forced because the patient appetite is poor. In prolonged illness, to provide adequate amount of food to prevent wasting of tissues. Diet is prescribed. There should be variety of foods for selection, like all the 5 food groups should be chosen in the diet, and small and frequent meals are preferred to usual 3 meals, like early morning to bedtime, the meal should be recommended. Hot food should be served hot and cold food should be served cool. And types of modification. It can be classified into 3: modification in consistency, modification in nutrients, and modification in feeding. Whereas modification in consistency is clear liquid diet, full liquid, soft diet, mechanically soft, and normal diet. Whereas modification nutrients like for especially diabetic patient, heart patient, and kidney like renal patients. And modification in feeding is oral, tube feeding, parenteral feeding, and enteral feeding. Now we can see about the modification in consistency. In that, first one is clear liquid diet. It is a temporary diet of clear liquids without residue and is non-stimulating, non-irritating, and non-gas forming. Small amounts of fluids like 30 to 60 ml in 2 hours interval to replace the fluid and electrolyte loss, and also to relieve thirst. Commonly, it composed mainly of carbohydrates, some electrolytes. It provides 400 to 500 kilocalories, negligible amount of fat, and carbohydrate should be 100 to 120 gram, and no protein is included in this clear liquid. It is an initial feeding between intravenous feeding and full liquid or solid diet that follows surgery. And this it is a very short term use when minimal digestion is required. It also includes clear broths, gelatin, and juice, and it is mostly used in the gastrointestinal issues and in the post surgery. And the conditions we can applicable is a preoperative period like colonoscopic examination, or post-operative phase like a surgery on the colon or rectum, and acute illness or infections as in acute gastroenteritis when fluid and electrolytes replace is desired to compensate for losses from diarrhea. First step in oral elimination of nutritionally debilitated persons. In temporary food intolerance, examples like barley water and dal soup is used. And the next one is full liquid diet. It includes foods which are liquid or can be liquefied at room and body temperature. It is free from cellulose, irritating condiments and spices. High protein and calories used. It is given between liquid and soft diet at the interval of 2 to 4 hours each day. The average nutritional composition of this diet is 1200 kilocalories and 35 grams of protein, and this diet is low in iron, vitamin B12, A, and vitamin B1. It is used for the individuals unable to chew or swallow solid foods. It includes milk, strained soups, or yogurts. And the conditions we can applicable is post-operative phase when progressing clear liquids to solid foods, acute gastritis infection following oral surgery or plastic surgery of the face or neck, in chewing and swallowing dysfunction in esophageal or stomach disorders causing intolerance to solid food intake. The foods can be chicken broth, lassi, and etc. And the next one is soft diet. It is used as a transitional diet between full liquid and a normal diet. Many hospital patients are placed under this diagnosis is made and nutritionally adequate. Soft in consistency, easy to chew, made up of simple, easily digestible food, limited fiber, does not contain any rich or highly flavored foods like spices or condiments should not be included in the soft diet. And approximately 1800 kilocalories, 50 gram of protein. Energy and protein is adjustable according to the individual's needs based on activity, height, weight, sex, age, and disease condition. In this soft diet, for those with chewing or swallowing difficulties, require soft or blended foods. It is mainly applicable in oral or dental problems. The conditions which are applicable for soft diet is while progressing from full liquid diet to normal diet during post-operative phase when a patient is unable to tolerate a normal diet, gastrointestinal problems, example diarrhea, genital depletion, and then inadequate dentition, convalescence, acute infections, and the example foods like custard and pureed fruit is used in soft diet. And mechanical soft diet, it is required soft diet simply because they have no teeth, and such diet is known as mechanical or dental diet. It is not desirable to restrict the patient to the food selection of the customary soft diet. The following modification to the normal diet may be made. Vegetables may be chopped or diced before cooking. Hard raw foods on vegetables should be avoided. Tough skins and seeds should be avoided. Nuts and dried fruits may be used in chopped or powdered form. Meat should be finely minced or grounded. The conditions like limited chewing or swallowing ability, post-operative phase of head and neck injury, dental problems, anatomical esophageal strictures, example idli pongal, mashed rasam rice, soft cooked dal, and etc. These are the foods that can be consumed in the mechanical soft diet. And the normal diet is defined as one which consists of any and all foods eaten by a person in health, keeping the basic 5 food groups in mind, that optimum amounts of all nutrients are provided in this diet. No restrictions on any kind of food. This diet is well balanced and nutritionally adequate to the individual who is suffering from any disease or the surgery. And if the patient is hospitalized or at a bed rest, a reduction of 10% in the energy intake should be made, and too many fatty foods or fried food should be avoided to digest. And proteins are slightly increased 10% to counteract a negative nitrogen balance. All other nutrients are supplied in normal amounts. In this next one is modification in nutrients. So in this diet is modified for various reasons such as treat disease, change body weight, or control diseases such as hypertension or diabetes. So first one, patients with diabetes recommended a diabetic diet which should give low glycemic index foods, avoided or refined carbohydrates and simple carbohydrates, and we should include a more complex carbohydrate foods. And the second one, patient with heart disease are prescribed a low cholesterol diet which also can be called as ARP diet. And next one is with renal failure and advanced liver diseases, the low protein diet will be suggested for them, and high protein diet, high calorie diet is recommended for patient with HIV disease, cancer, or malnourished. The individuals who are overweight or obese, a diet low in fat and calories is recommended. So these are the diet that comes under modification in nutrients. And also low sodium diet used for managing hypertension, heart disease by restricting salt intake, and high protein diet used for recovery from surgery, trauma, or illness to promote tissue repair and muscle strength. And low fiber diet reduces fiber for those with digestive issues or alters certain surgeries. So the next one is modification in feeding. In this first one is oral feeding. Preferred and most palatable method of feeding, nutrition supplements can be added to the oral diet. When the patient is not able to feed themselves, so either the nurse or the attendant will feed them by the oral feeding. So the next one is enteral feeding, done orally or tube feeding, given gut functions normally and retains the epithelial structure and function. Idealized formulas to nasogastric, duodenal or jejunal routes. So the next one is tube feeding, done through the nose called nasogastric feeding or by a surgical operation, gastrotomy or jejunostomy directly into the small intestine. And the next one is parenteral feeding with a continuation method of providing complete nutritional support in which the gastrointestinal tract is bypassed by introducing nutrients into a central vein. So it is used mainly in cancer patients associated with malnutrition, given to short-term bowel syndrome, hepatic disease, and pancreatitis. And total parenteral nutrition included 100 gram of glucose per day to prevent protein catabolism and includes emulsified fat, crystalline amino acids, vitamin B12, folic acid, which is vitamin B9, and vitamin K, and electrolytes include sodium, phosphorus, potassium, calcium, magnesium, and water. So, thank you.